Air pollution is a truly damaging environmental insult to the human body, and the main effects that it has are cardiovascular and strokes and heart attacks, also on the lung of course, and here we have bronchitis, pneumonia in the elderly, asthma in younger people, and even effects on cancer, which are becoming increasingly concerned. And finally, we're recognising that air pollution can have effects, for example, on diabetes, obesity, skin ageing, problems with the eyes. So these are systemic effects of air pollution.
I was going to ask you, so who is most at risk from air pollution?
People who have underlying disease, particularly cardiovascular disease, such as small strokes, or people who've got heart problems, hypertension, but also people with underlying lung disease, of which there are many different types, all of which are adversely affected by pollution.
And there's a figure being quoted, isn't there? It comes in your report, the 40,000 excess deaths. Can you tell us about how confident you can be in that figure?
Well, 40,000 has estimates around it. It's made up of both particulates and oxides of nitrogen. And we have, I think, taken account of the variation as far as possible. And this is an average that we came up with. The government's medical committee looking at air pollution is going to come up with a figure fairly soon, which we'll see how close it is to the 40,000.
And can you just tell us what sort of research that 40,000 is based on? Because it has been criticised, hasn't it? And it's nice to kind of understand exactly how confident people can be in it.
The research is epidemiological. Large cities from across the world, United States, Europe, Australia, other parts of the world, and are coming up with fairly similar figures. That is, that certain levels of pollution drive a certain adverse health effect. And the statistics look increasingly strong.
And when we talk about excess deaths, we're really talking about premature deaths, people dying years younger than they would otherwise. Is that how it works?
That is exactly correct. And this is deaths brought forward, really, particularly in people who've got pre-existing diseases.
I was going to ask you, so who is most at risk from air pollution?
People who obviously are overweight, people who don't exercise, people who have already got cardiovascular heart problems, people who have lung disease primarily. And they're all at increased risk. And of course their deaths are brought forward to a greater degree than the average public.
Are governments taking this seriously enough?
Parts of government are. Local governments do take it seriously. Let's just take London as an example, with Sadiq Khan, who's doing a wonderful job. But I think central government, we've got a real problem here. And although they declare it's one of the greatest health problems of this particular century, we haven't actually got any real changes coming in yet.
Would tackling air pollution make an immediate difference to people, or will this take years?
It will have an immediate effect. When the smoking ban came in public places, not only did it affect, of course, the cancer in those working in bars and things, but also affected asthma admissions to hospital, with a 15 to 20% reduction in asthma admissions happening almost immediately the introduction was put in place.
Is it your view that tackling diesel makes sense as a first stop?
Well, the UK has more of its car fleet as diesels than any country in the world. 50% of our car fleets are made of diesel. And the problem with diesel, of course, is the oxides of nitrogen, and that's where the new evidence has come from in terms of driving these adverse health statistics. So diesel would seem an obvious choice. And if we cleaned up and retrofitted diesels, and if we took away the old diesels, we're going to improve the city centres, particularly where pollution is worse.
What would you like doctors to do, Stephen?
I would like the health professions to take ownership of this particular problem, because up until now it's been somebody else's problem. And I'd like the health professions across the whole piece to say this is all part of our responsibility, and that we should be setting examples and helping the public understand what the issues are so that they can then help themselves.
Stephen Holgate, thank you very much indeed.
Thank you.